Welcome to Learn at Work podcast, which is sponsored by iOS Press, the publisher of Work, a journal of prevention, assessment, and rehabilitation. We're delighted to host this podcast that will bring together insightful conversations and thought-provoking discussions on topics that matter most in the realm of health, rehabilitation, work, prevention, and assessment. What can you expect from our podcast? We'll have expert interviews, individuals who have published in the journal, and we'll dive into conversations with leaders who have shared their valuable experience and expertise. You'll learn about different latest work trends, technology, and best practices. I'm Karen Jacobs, the founding editor of Work, and I'm the moderator of these podcasts. Welcome to this episode of Learn at Work, the podcast for the journal Work. I'm delighted to have as our guest today Ardalan, who is an author of articles in Work and a real supporter of the journal. So I'm going to have you introduce yourself. Tell us where you're located. We're traveling around the world with this episode. And maybe we can start with you sharing your career with us. So welcome.
Well, good morning, dear Karen. Thank you very much for inviting me for this podcast. First of all, I have to say thanks to work and the editorial board because it's almost 8 years I have collaboration with this team, and I had a very good experience during this special issue. My name is Ardalan Shariat, an assistant professor in Department of Digital Health, School of Medicine, Tehran University of Medical Sciences, located in Iran. Actually, I took my PhD in University Putra Malaysia called UPM, and then I was invited to my country, Iran, by Talent Association to do my postdoctoral in the field of neurorehabilitation. Right now, I act as a researcher and also assistant professor in our department. In the same time, I'm an editorial board for Work and also for another journal called Journal of Exercise Rehabilitation, and also executive manager in Asian Journal of Sports Medicine. Today I'm here and very happy to see how we can talk and discuss about our special issue.
Yes, thank you. Thank you for giving us that background. Yeah, let's just start with the special issue. And if you could share, I guess, what motivated you to want to be the guest editor of the special issue, and what is it? What will it be about?
Honestly, it's for a long time I'm working and doing research about musculoskeletal disorder, especially among office workers, and also do some exercise rehabilitation for the patients post-stroke. But after pandemic, I found that it's necessary for everyone to get familiar and do the research using online platforms such as any kinds of teleconsultation or telecare for the people around the world. So it was the reason that I started my career and continued my career, which focused on telehealth. In this special issue, I wanted to invite the researchers around the world to see how they can conduct their work not only based on face-to-face consultation, but also using online platforms. In this special issue, we had actually 7 papers that accepted by work. Before this also we had an announcement published in Work and invited all the researchers to submit their work. This special issue has presented multiple novel and practical achievements in telehealth through the publication of 7 papers, including various subtypes of articles written by experts from Iran, the United States of America, Malaysia, India, and Saudi Arabia. Our team has been thrilled to be a part of this illustrative series of papers, and we look forward to receiving and reviewing additional high-quality submissions to work. It means, okay, this special issue is already closed, but it's still in work. We are waiting to receive more and more related papers. In this editorial, we would like to review some of the interesting findings presented by our international colleagues. We would additionally like to thank the Journal of Work for their collaboration in bringing this special edition for fruition. So, if you are okay and if you are agree now, I want to have a very short summary about accepted papers. In the first
That
paper
would be
published in
great.
this special, yeah, in the first paper published in this special edition entitled Educational Competencies for Telehealth Physical Therapy, result of a modified Delphi process, written by Davenport et al., it was concluded that consensus-based educational competencies identified in their study could be useful as a guidance in knowledge and skills related to the provision of physical therapy services via telehealth services. In the second paper of this series entitled Evaluating the Impact of Work from Home Policies on Google Search Trends Related to Ankle Surgery During the COVID-19 Pandemic, authored by Wu et al., a unique use of an internet-based search engine was employed to assess the impact of pandemic on interest on a specific based search engine was used. Several topics seem to garner amplified attention during the pandemic, including ankle arthritis and ankle bursitis, as measured by increased Google search metrics. In contrast, post-pandemic search metrics yielded decreased interest for 9 terms. Ankle pain and ankle tendinitis search were decreased post-pandemic. As tendinitis is considered as overuse condition, this decrease may indicate pandemic-related decrease in overall activity. I think the findings of this research could be useful not only for the people related to telehealth or general physician, but also for the infection purposes. In another paper written by Purushothaman et al. Entitled From Home to Health Telerehabilitation Contribution to Physical Activity and Quality of Life in Young Adults Teleworker, the authors again focus on similar issues related to the work from home. In this investigation, telehealth will be used to provide rehabilitation interventions to improve the level of physical activity and quality of life among remote workers. I always emphasize to my students and to young researchers that now we have to see which kind of therapy, which kind of consultation is more feasible. Now the world is changed. After pandemic, everything changed. We have to see how we can give services to the people in far places, the one who are not in capital, the one cannot pay easily for coming to hospital. Other manuscripts within this series have explored related topics within the field of telehealth. In a commentary entitled Leveraging and Learning from the Long COVID Experience, Translating Telerehabilitation into Practice, written by Gustafsson et al., the authors provide a tutorial in translating telerehabilitation principles into practice using the available experiences during the COVID-19 pandemic, based on several key action steps. Following this, another article published by Dr. Behboudi Mogaddam and Bahram Nejad in their letter entitled The Role of the Stroke Among Pregnant Mothers, Groundbreaking Innovations in Maternal Healthcare, attempt to attract the attention of researchers to the importance of interventions geared toward recognition and treatment of maternal stroke through virtual means. These authors seek to revolutionize maternal health care by providing timely and specialized care to pregnant women at risk of stroke. While other areas of telehealth receive more consideration throughout the literature, a commentary written by Dr. Haji Ali Askari et al. Focus on an important yet perhaps underexplored area of healthcare provision via electronic means. I just add something here because I'm in Iran. Iran is one of the countries that focus also on herbal consultation, and we have also one department called Department of Herbal Medicine. It's something such as another department in China, and it's already accepted by individuals that not always they use chemical medicine, and sometimes they prefer to go by traditional methods of treatment. So I think it's also necessary not only for modern physiotherapists or physicians, but also for traditional therapies and traditional therapists to go through online platforms. So the last paper already published by Dr. Haji Alaskari focus on this point. They invite the researcher within this field to improve upon the existing body of research by conducting randomized controlled trials. Teleconsultation may be allow for an herbal medicine practitioner to more appropriately recommend specific interventions which could be employed in a more targeted approach. And finally, in a narrative review entitled Utilization of Telemedicine for Diagnosis and Follow-up within Foot and Ankle Orthopedic Surgery, that was a narrative review written by Pulaski et al. Telemedicine was introduced as a supplement for traditional foot and ankle clinical care. This article highlighted the benefits of telemedicine in foot and ankle orthopedics. Overall, this special issue for the Journal of Work has helped demonstrate the importance of telehealth and the related subheading in the prevention and treatment of different varieties of health-related issues. While several important findings are presented, the common theme across each of these investigations is the lack of search in this area, because more high-quality research is needed to ascertain whether the provision of healthcare via internet-based platforms meet quality and patient satisfaction standards while remaining cost and time efficient. Okay, this was a very short summary about what we done and what we already accepted and presented in this special. I'm ready if there is any more questions.
Yes, thank you. That was a very thorough overview for the special issue. I'd love you just to give us maybe a little bit more background about, your career. Maybe, what interests you to go into this field. I think our listeners would really love to learn more about you personally.
Actually, because I have to say about myself that I was in national team of judo in my country for a long time, and I'm a sportsman. So I always face with different kinds of musculoskeletal problems. And I always see that there is not such a very easy way or easy method for treatment. And then once I started my job as an assistant, just research assistant, long time ago, I had to stop my professional exercise and I was changed to office worker. So always I was thinking, now there is no time to do exercise. No, there is no time to go to gym. So what I had to do, then I started to make some office-based exercises. And this is what exactly I did in Malaysia in my PhD thesis. I modified some of the available exercise and simplified to be used in office because everyone know okay exercise is good, everyone know that they need to do exercise, but once you talk with people they say there is no time to do. If we want to go to gym it takes too much time, there is no time to spend with my family. So there was a need to simplify and make some exercise useful in office. Then it was going ahead very well until the time we faced with pandemic. So the office already closed. People were at home. And in the beginning, everyone were happy. Maybe, okay, no need to go office. We can spend the time with family. But slowly, the problem raised up. Slowly, low back pain, neck pain, shoulder pain, overweight. So there was a need that you go to digital platforms, you make the video and send them. You couldn't see them face to face, so you needed to go maybe through Skype, WhatsApp, Telegram, and talk with them. And always there was lack of rules, lack of regulations. For example, I already paid to receive a teleconsultation. Suddenly, internet stopped working. So who is responsible for it? Or I am giving some consultation to my patient. He doesn't understand some points and just say yes. So who is responsible for it? So there was a need also to determine some regulations and rule for it. And slowly, not about only the physician, but only about all the health related services move to digital platform. And the other point raised once we were talking about internet. Now we are in Iran, in a country that is considered as a developing country, and there are too many countries such as Iran that they need to all these platforms, they need to use these rules and regulations to give services not only to the people who are living around the hospitals or in big cities. Because once we talk about telehealth, it means how we can give service to anyone in any distance. So it would be very important that now we are focusing on this aim. We are trying to giving the services, for example, for geriatric, for the pregnant mother, for the office worker, anyone in any place in Iran, that just we are giving teleconsultation in our department.
Thank you. Thank you so much. Um, as we conclude this episode, I'd love you to share some of your just personal interests. What things do you like to do when you're not working? I think that would be really interesting. For example, for me, I love photography or in the winter skiing, cross country skiing. What do
Okay,
you like
okay.
to do?
Okay. Actually, as I was a professional athlete, once I stopped doing exercise professionally, I like to eat. I enjoy eating and also cooking at the same time listen to the music because I don't know how to cook very well, but I always try to mix everything together and make something new and I make a name for it by myself and I try to enjoy from what I cook. And then I listen to music so I cannot understand the taste. I will just eat and enjoy from the music. This is what I do.
Well, it's funny we have that in common. I love cooking, and I have one of the From the Editors, coming up in the work journal. That's, sort of what I write at the beginning of each issue, a couple of recipes that I like. So you'll have to check those out, and, I hope you enjoy them. I enjoy cooking too, and I actually teach, um, vegetarian cooking as, an initiative with our Sergeant Choice Nutrition Center here at Boston University. It's a wonderful
Nice,
occupation to do. Well,
definitely.
thank you for being a guest on Learn at Work, and thank you for all your years of work with the journal. We greatly appreciate all your support and your contributions. You really have added to the evidence literature, and we're so grateful to you.
My pleasure. My pleasure. I enjoyed talking with you and I enjoy working with my family that is work. Have a good day ahead and take care. Bye bye.
Take care. Bye bye.